registration is mandatory for government as well as the private entities. The place where the USG is done is registered. It is not the machine that is registered. We first have to register the place with the PCPNDT authority. For that, we need at least 100 square feet area room. Application is to be made 3 months in advance, and application is made to the Chief Medical Officer of the district or any other medical officer constituted as appropriate authority by the government. Application should be made in duplicate in Form A. Affidavit is to be attached that sex determination will not be done in the clinic. Application fee is rupees 3,000. It may vary from state to state because different states have their own laws over the PCPNDT. Registration once done is valid for 5 years, and 1 month before the expiry we have to apply for the renewal. This is the Form A that we are supposed to fill in, and this is the affidavit that needs to be submitted. The names of the doctors from the center get registered on the registration certificate. So any doctor who has been registered for that specific center can perform the ultrasonography. Anyone who is not registered is not supposed to perform the ultrasonography. Number of machines, there is no restriction to having any number of machines in single center, but every machine needs to be separately registered with the PCPNDT. If a new machine is bought, we have to send a notification. USG machine cannot be transferred from one center to another without informing the PCPNDT or the appropriate authority. If say we want to keep our machine mobile, generally the certificate or the registration is given for keeping the machine in the USG room. If we want to move around the machine in the hospital, say to ICU, to room or wards, we have to give a separate application, and then we get a permission from the appropriate authority to make the machine mobile inside the hospital only. It does not allow us to move the machine outside the hospital premises. What certificates or what needs to be displayed in the USG room where ultrasonography is performed? Certificate of registration is to be displayed. Copy of PCPNDT Act should be available. The names of doctors registered with qualification should be displayed, and there should be a notice displaying conduct of sex determination, disclosure of sex is prohibited by law and is punishable offense. This is a typical poster that we have in our own hospital, and this is the registration certificate from PCPNDT, where there is a name of the hospital, and attached with it are the list of doctors who are registered on the machine. Here we can have anybody being registered on the machine to perform sonography. So it can be a nephrologist, it can be a cardiologist, it can be a gynecologist, it can be our intensivist as well, or it can be a cardiologist as well. For centers that are not performing obstetric USG, there is no need to fill the Form F. Has to be a declaration in the scan area that obstetric ultrasound is not performed in this center, but still we are supposed to send the records of USG's ultrasonographies done in last month to the appropriate authority every month by 5th of the month. Who can sign a report as a sonologist? So PCPNDT Act states that any registered medical practitioner who has undergone 6 months of training in ultrasonography can be termed a sonologist. So any person who possesses an MBBS degree and postgraduate qualification in either radiology, even gynecologists have 6 months of training incorporated in their PG degree program, so they can also sign the report. But as a nephrologist, if say I am doing ultrasonography of kidney and I want to release a report, if I want to sign it as a sonologist, ideally I should undergo 6 months of training and I should have a appropriate certificate. So this 6 months course in sonology was proposed only by the PCPNDT team. So it is called the fundamentals in abdominopelvic ultrasonography level 1 for MBBS doctors. The period of training has to be 300 clock hours, and eligibility is any person who has a MBBS degree can register for this course. This course is run in many of the government hospitals and medical colleges. And after completion, we will get a certificate of 6 months training in ultrasonography, and there is a competency test that we need to pass. The certificate is to be signed by Director Medical Education and countersigned by the concerned state appropriate authority. What can be medical legal issues related to performing POCUS? When I was preparing the talk, I just remembered there was a case from a reputed hospital in Mumbai where thoracentesis or pleural tapping was performed in the casualty without using an ultrasonography machine. Unfortunately, the tapping needle pierced the spleen and there was a massive hemorrhage, and patient succumbed to that hemorrhage. Patient could not be revived. So the consumer court directed the doctor. It was hospital was acquitted in that case because hospital said that we had all the facilities available in our hospital. The performing doctor did not use the machine when it was required. So it was the doctor who was asked to pay 41 lakh rupees of fine to the patient for not using USG machine to perform a pleural tapping. Apart from these, majority of the medico-legal cases that I came across in India are mainly related to the anomaly scan that is performed by either gynecologist or radiologist, where fetal anomaly is missed or not diagnosed in time, which resulted in a birth of malformed child or child with deformity. If we search the international data, it is a data from one of the data I could find from the Canadian study. So the conclusion from the study was the most common reason associated with medico-legal action in these cases was failure to perform POCUS when indicated rather than performing the POCUS. So majority of the cases were related when indicated a patient, there was a suspicion of pulmonary embolism and DVT scan was not performed, and that was the reason for the medico-legal issues. Another review article from the United States, it also again pointed out that the most common primary allegation was failure to perform an ultrasound. No cases clearly alleged misinterpretation of a POCUS. So as other studies also have suggested, non-performance of ultrasound seems to convey the greatest medico-legal risk. In our day-to-day clinical practice in nephrology and critical care, what can be the potential reasons for having a medical-legal issues related to use or non-use of POCUS? It can be arterial lung injury while performing a dialysis catheter insertion or a CVP line insertion. Splenic liver injury, as we saw during pleural tapping, intestinal injury while performing ascitic tapping, and splenic liver injury during a kidney biopsy. Although very rare, but there have been cases that have described where a spleen was injured while performing a kidney biopsy because patient had a big splenomegaly. So whenever we are performing POCUS, the most important aspect that we have to keep in mind is there should be adequate education, training and competency certification. As of now, in India, apart from the 6-month sonology course or the small courses run for echocardiography, there are no accredited courses giving us a certificate that you are now enabled or competent radiologist. As Dr. Sethi also pointed out in the morning, now they are trying to make a curriculum kind of thing where there can be a competency-based scoring that such person has obtained the basic level of POCUS skills and this fellow has obtained advanced level of POCUS skills. There can be errors related to acquisition and interpretation of ultrasonography images. This can be related to patient factors like obesity, presence of excessive bowel gases, abdominal distension, inability to visualize IVC as we discussed in the morning. And then there can be limitations related to our equipment as well, because there are different kind of machines, the range starting from small handheld devices to higher end devices being used by cardiologist or the radiologist. Another important aspect is lack of integration in the clinical context. Only treating on the basis of reports or only going by the clinical criteria, we should have a comprehensive approach where we integrate both clinical as well as the imaging features that we see. And the legal aspects can be related to claims, both failure to perform POCUS when indicated and can be related to diagnostic errors. Prevention is most important is adequate training, image acquisition, documentation. Whatever we are saying, we have to document it in the patient's papers or in the form of report. And whenever feasible, it is best to store the images or take a printout and attach it to the patient's file. So this remains as a long-term proof that what was seen has been documented. So take-home message: setting up USG machine in hospital, we need to be aware of the legal nitty-gritties. It is not complicated. Sometimes we just feel that it is very complicated to have a sonography machine. We should be aware of rules and regulation. And most important is not using Pocus is more likely to cause medico-legal harm than using Pocus. Thank you.